Hey there. If you've crossed the threshold of 60, you've probably noticed that sleep isn't quite as simple as it used to be. It used to be that you could fall asleep on a hardwood floor or a cramped airplane seat and wake up ready to run a marathon. But now, you wake up with a mystery pain in your hip, or maybe your neck feels like it's been set in concrete overnight. Most of us tend to blame our mattress, the humidity, or just the general wear and tear of getting older. But the truth is often much simpler and much more within your control. It's how you're positioned during those 7 to 8 hours of rest. By the time we hit our 60 seconds, our bodies have undergone significant physiological shifts. Our joints have less synovial fluid, that's the natural lubricant that keeps things moving smoothly. Our spinal discs, those little shock absorbers between our vertebrae, have naturally lost some of their hydration and height, making our backs more sensitive to misalignment. Even our skin and circulatory systems change, becoming more prone to pressure sores or poor blood flow. Today, we are going to dive deep, really deep into the 4 sleeping positions you should absolutely avoid if you want to protect your long-term mobility, and the 4 life-changing adjustments you should try instead to ensure you wake up feeling refreshed, vibrant, and ready for the day. Let's start with the first no-go zone, and this one is a hard habit to break for many: the chronic stomach sleeper. I know, some of you have fallen asleep this way since you were toddlers, and it feels like the only way to get comfortable. But after 60, this is arguably the most damaging position for your musculoskeletal system. Think about the mechanics. When you lie on your stomach, you cannot breathe through your pillow. This forces you to turn your head to one side or the other for hours on end. This creates a massive, sustained twist in your cervical spine. It's essentially like walking around all day with your head turned 90 degrees to the right. Over time, this puts incredible strain on the ligaments of the neck and can lead to chronic tension headaches, pinched nerves in the shoulders, and a significant loss of range of motion. Furthermore, stomach sleeping causes your midsection to sink into the mattress, especially if your bed isn't extra firm. This creates an unnatural arch in your lower back, known as hyperextension. For a senior with even mild degenerative disc disease, this compression can lead to intense morning stiffness or locked back muscles. You're also putting direct pressure on your internal organs and your lungs, making each breath require more effort from your diaphragm. If you wake up feeling like you've been in a wrestling match rather than a bed, your stomach sleeping habit is likely the primary suspect. The second position to avoid is the soldier on a flat surface. Now, you might have heard that sleeping on your back is the gold standard. And while that's true in theory, doing it completely flat is often a disaster for the 60-plus demographic. Gravity is a relentless force. When you lie flat on your back, gravity pulls your tongue and the soft tissues of your throat downward. As we age, these tissues naturally lose some of their tone and elasticity. This creates a narrower airway, which is why snoring often worsens as we get older. More seriously, it can trigger or exacerbate obstructive sleep apnea, a condition where you actually stop breathing for short periods. This deprives your brain of oxygen and puts a massive strain on your heart. From a structural standpoint, lying flat also creates a physical gap between your lower back and the mattress. Unless you have the core strength of a gymnast, your lower spine will eventually collapse into that gap, leading to lower cross syndrome or general lumbar strain. If you've ever felt like you had to roll out of bed because your back was too stiff to sit up, this flat back position is likely why. Third on our list of positions to retire is the arm under the pillow side sleep. We've all been there, tucking one arm up under our head or even under the pillow to get that extra bit of elevation. In our 60 seconds, our rotator cuffs, the group of muscles and tendons that stabilize the shoulder, are much more prone to inflammation, thinning, and tearing. When you place the weight of your head, which weighs about 10 to 12 pounds, on your arm, you are essentially crimping the hose of your circulation. You're also compressing the brachial plexus, the intricate network of nerves that runs from your neck into your arm. This leads to that pins and needles sensation, or the dreaded dead arm that wakes you up in a panic at 3 a.m. Long term, this habit can lead to bursitis or even frozen shoulder, a painful condition that can take months of physical therapy to resolve. Your shoulder joints were never meant to be used as a mattress topper. And finally, the fourth one to avoid, the extreme fetal position. I'm talking about being curled up so tight that your knees are nearly touching your chin. While this feels cozy and protective, almost like a return to the womb, it's quite hard on a maturing body. This extreme flexion rounds your entire back, stretching the spinal ligaments too far and compressing the front of your vertebrae. It also tucks your chin tightly into your chest, which can restrict your airway and make your breathing shallow. Shallow breathing means less oxygen reaches your bloodstream, which can leave you feeling groggy and brain fogged in the morning. Additionally, if you suffer from even a touch of arthritis in your knees or hips, keeping them bent at such a sharp angle for hours restricts blood flow and causes the joints to gel or stiffen up, making those first few steps out of bed in the morning incredibly painful. So, now that we've identified the culprits, what should you do instead? How do we fix this without feeling like we're sleeping in a straitjacket? Let's get into the 4 healthy alternatives. Solution number 1, the supported back position. If you are a natural back sleeper, you don't have to change your orientation, just your setup. You need to bridge the gaps to support your body's natural curves. The most important addition is a medium-sized, semi-firm pillow placed directly under your knees. By elevating your knees slightly, you tilt your pelvis back, which flattens your lumbar spine against the mattress and removes the gap we talked about earlier. This instantly decompresses the nerves in your lower back. If you struggle with snoring, acid reflux, or GERD conditions that affect nearly 40% of seniors, you also need to address the top half of your body. Invest in a high-quality wedge pillow, or, if your budget allows, an adjustable bed base. You want your upper body elevated at about a 20 to 30 degree angle. This uses gravity to keep your airway open and prevents stomach acid from traveling up into your esophagus. This position is also fantastic for those who experience edema or swelling in the legs and ankles, as it helps the heart pump blood more efficiently back up from the lower extremities. Solution number 2, the aligned side sleep. Side sleeping is actually the most recommended position for brain health as we age. Recent studies have shown that the glymphatic system, your brain's waste clearance system, functions most efficiently when you are on your side. It's like a nightly car wash for your brain, clearing out the beta amyloid proteins associated with Alzheimer's. However, the key to successful side sleeping is the 3-pillar alignment. You want your ears, shoulders, and hips in one straight line. The secret weapon here? A dedicated knee pillow. Not just a thin piece of fabric, but a thick, supportive pillow placed between your knees and extending down to your ankles. This prevents your top leg from falling forward and pulling your pelvis into a twist. When your pelvis is square, your spine stays neutral. For many of my clients over 60, this one change alone has eliminated years of chronic hip and sciatica pain. It takes the pull off the lower back and lets the muscles finally turn off for the night. Solution number 3, the hugger position. If you find it impossible to stop reaching your arm up under your head, you need a substitute. Try the hugger. Instead of reaching upward, reach forward and hug a full body pillow or a very large, firm, standard pillow against your chest and stomach. This serves 2 vital purposes. First, it provides a shelf for your top arm to rest on, which prevents your top shoulder from collapsing forward and down toward the mattress. This keeps the rotator cuff in a neutral, relaxed position and prevents the chest muscles from shortening and tightening overnight. Second, having that physical contact against your chest has been shown to lower cortisol levels and stimulate the release of oxytocin, helping you feel more secure and reducing the tossing and turning that often comes with age-related anxiety or restlessness. And solution number 4, the log with precision neck support. For those who feel generally stiff and want the most clinical orthopedic approach, try the log position. This involves sleeping on your side with your legs almost straight, just a very slight 5-degree bend in the knees to keep them from locking. The critical component here is the pillow height. Most people use a pillow that is either too flat, causing the neck to tilt down, or too fat, pushing the neck up. To find your perfect fit, have someone take a photo of you lying on your side. Your nose should be in a perfectly straight line with the center of your chest. For most seniors, this requires a contoured memory foam pillow that fills the exact gap between your ear and the tip of your shoulder. When your neck is neutral, your central nervous system can fully relax. This reduces the fight or flight signals being sent to your brain, allowing you to drop into the deeper stages of REM and slow wave sleep, the stages where your body actually repairs tissue and strengthens your immune system. Now, changing a lifelong sleeping habit isn't easy. It takes about 21 days for your brain to accept a new default position. You might wake up in the middle of the night and find you've kicked the pillows across the room or rolled back onto your stomach. That's okay. Don't get frustrated. Just gently reposition yourself and go back to sleep. You might also want to look at your environment. For us, over 60, our thermostat can be a bit finicky. Keeping your room between 65 and 68 degrees Fahrenheit is the sweet spot for deep sleep. Also, consider your sleep hygiene before you even hit the mattress. As we age, our production of melatonin, the sleep hormone, naturally declines. This makes us more sensitive to the blue light from our phones and televisions. Try to dim the lights an hour before bed and perhaps engage in a very light stretching routine. Simple cat-cow stretches or gentle windshield wiper leg movements while lying on your back can help lubricate those joints we talked about, making it much easier for your body to accept these new, healthy positions. Another tip for my fellow seniors: watch your hydration. We know it's important to stay hydrated, but drinking a giant glass of water at 9 p.m. is a one-way ticket to multiple bathroom trips, which disrupts your sleep cycles. Try to get the bulk of your hydration in before 6 p.m. and just have small sips if you're thirsty later. This helps you stay in those corrective positions longer without interruption. Lastly, let's talk about equipment. If your mattress is more than 8 to 10 years old, it likely no longer provides the structural support your spine needs. You don't necessarily need the most expensive bed on the market, but you do need one that supports your specific sleeping style. If you're a side sleeper, a medium plush top with a firm core is often best. If you're a back sleeper, you want something slightly firmer to prevent that hammock effect. Remember, you spend about a third of your life in bed, in your 60 seconds, 70 seconds, and beyond. That time isn't just rest, it's recovery. It's the time when your body fixes the damage of the day and prepares you for the adventures of tomorrow. Making these small, intentional adjustments to your posture isn't just about avoiding a morning ache. It's about maintaining your mobility, your independence, and your overall quality of life. It might feel a bit strange for the first few nights, but I promise you, if you stick with it, you will wake up one morning and realize that mystery pain is gone. You'll realize you have more energy for your grandkids, your hobbies, and your travels. Your joints will thank you, your brain will thank you, and you'll find that your 60 seconds and 70 seconds can be the most well-rested years of your life. Sweet dreams, and I'll see you in the next video where we discuss the best morning stretches to pair with your new sleeping habits.